Thanks, Sarah. Thank you, Sarah, and thanks to your team for bringing us a virtual town hall opportunity today. Welcome, everyone. The purpose of this time together is to understand what decisions are being made, what decisions are yet to be made, and about our opening for in-person instruction in the fall, and to answer the over 100 questions that were submitted from many of you who are on this call. I want to begin with a heartfelt thank you to all of you for all that you have done since COVID entered our lives. I also want to make note that COVID is not the only tragedy and difficulty we're facing as a nation. And if we were together, we would be doing more, I think, to call that out and to deal with some of the tragedy and heartbreak that's happened just over the last several weeks. That said, I'm so grateful to all of you for all of the work and tolerance and patience that you have exhibited during this time of very serious uncertainty and very serious threat from the COVID virus. I also want to say that in times of emergency like this, cultures can get stronger. And as you know, as your chancellor, I'm trying very hard to help us re-emphasize our collegiality, our collaboration, to take down the stovepipes that may have existed and even the hierarchies that have existed perhaps in the past, to lead all of us as leaders of the institution with transparency, openness, attention to inclusion, intention to making ourselves a welcoming place for all persons. And I hope that this crisis, however difficult it is for us, will bring us closer as an academic and collegial community. We all know how uncertain and how unclear so many things are at this moment of time. This is not only uncertain, it's an ever-evolving situation. Over the last 10 weeks, since we were asked to adjourn and go to online only, we've learned so much, and yet we have so much to learn about the virus, and particularly about the ways that we as a community can establish standards that allow us to be in the healthiest possible, safest possible arrangement in the fall as we gather back together. I've been asked, what are the reasons to open? Let me give you my view on this, and I think this reflects some of the opinions as well of the senior staff. I believe that the most important reason to open is because we are a vital and important institution with an academic mission that needs to contribute to our state, our region, our city, our county, and to make ourselves a viable organization that educates our students. I also believe that student needs and demand are asking for us, if safely possible, that we open. We have many, many students who only want to return if we can be in in-person instruction where they get the absolute energy and vitality of our faculty and staff, teaching them and leading them in their own growth and intellectual development. Parents, particularly of our traditional age students, are also clamoring for the opportunity for their students to return, not just to get them out of the house, which I know you've heard some jokes about in the media, but really because parents understand that their sons and daughters get a superb, excellent education here, largely because of the quality and dedication of our faculty and our staff. The region needs us. We are an important economic driver, but even more importantly, we want to sustain the employability and the financial vitality of this institution. And we hope, if the best protocols can be adopted, that we will be ready to move in that direction. We're not making these decisions alone. Each one of the senior staff has been meeting with their compatriots across all 17 of the institutions, in some cases, like the chancellors, weekly for the last 6 to 8 weeks. We've been sharing ideas and learning how to do this right for all of us and all of us together in the name of good health and safety for our faculty, staff, and students. The UNC system leadership has been an important guiding force, giving us some opportunities to make decisions on our own and then some opportunities to learn what they think actually are dictated best protocols. The state legislature and the federal government are involved. The first tranche of the CARES money has arrived, and we are helping students who have been hit directly financially through the advent of COVID. There'll be more money coming. We don't yet know how much we will get, but just the CARES money alone can be of some support to us as we make our list of the gear needed to have the health best practices in place, and how we secure that gear to make ourselves safe and to keep ourselves in a community spirit, doing what is right for every individual and for the common good. Our Faculty Senate has been involved in a number of these conversations. We've just had 2 town halls and conversations with our staff. There are health directors in our city, state, county who have been directing a lot of what we do, in addition to the best standards coming out of CDC for higher education and for athletics in higher education specifically. Legal entities have a say about what we're doing right now, about best practices, and we are seeking to learn everything we can. We also have terrific expertise on our own campus that's been leading us in some of this. David Weldon, who is our Chief Emergency Operations Coordinator, and his entire Emergency Operations Committee that many of our faculty and staff serve on, have been thinking through the most humane, but the highest standards of health and safety for us as a campus to return. So there are many people giving us directions, ideas, and suggestions, and your voice matters. Every question that you ask helps us to do the work better. Every concern that you express makes the entire institution stronger if we can address that concern and work our way through. So let your voice be heard. Let me now turn to the questions that we received. We've boxed them into some topical entities to start. There's a box of university-related questions that I will just repeat to you and then try to give you the best answer that I know at this time. There's also a box that relates directly to health and safety. I'll also try to deal with those and ask that Bill Haggard weigh in if he wishes to. Then there's a couple of questions on our planned commencement for August 1st. There are questions related to academic affairs that I'll ask Provost Campbell to address for all of us. There are specific student life questions about residence life, co-curricular life, athletics, and our dining services to be answered, and then human resources questions. So I'm happy to be joined today by your colleagues, Provost Campbell, Vice Chancellor Bill Haggard, who's Vice Chancellor of Student Life, and Heather Parlier, who's our Chief Legal Officer, Director of Human Resources, and Vice Chancellor, also in charge of all of our diversity and equity initiatives. So let me start and make sure that you understand that what I can't answer or I don't know, I'm simply going to read the question and tell you that. We have a lot of work to do in this very uncertain situation, but your questions, again, are helpful in guiding us about what's most important. Question number 1, can you provide ideas for a best possible scenario for the coming months and a strategy for the worst case scenario? Please include how students will be helped in both situations as well as faculty. Well, perhaps I should start with the obvious, the financial scenarios that we are currently creating under the leadership of John Pierce and his team with Clayton Fogg and Mary Hall and others. The financial scenarios will be driven by 4 particular variables. The first one is how much it costs us to employ and implement all of the best practices with COVID. While we're able to procure this equipment without paying the exorbitant prices and the price gouging issues that are at hand in the nation, and we're doing our procurement both through the UNC system, directly with some vendors, and also through MAHEC. The financial scenarios will be dependent on how much we have to spend to keep ourselves and each other safe. The second variable is enrollment. Enrollment of first-time first years, enrollment of transfer students, and continuing student enrollment. I'm thrilled to report to you that thanks to the work of our faculty and our staff, the numbers for returning students, our continuing student cohort, is high, and it appears that the retention is measurably stronger than it has been over the last 3 academic years. Another part is what happens with the state appropriation coming from the legislators and the Board of Governors. Because the state is finding itself financially challenged with a shortfall in tax revenue, and obviously all the needs for unemployment insurance, healthcare, Medicare, Medicaid, other issues, it could be that we will face a 5 or a 10% state appropriation cut. Either one of those scenarios is very hard and difficult for UNC Asheville because we already run at such a tight fiscal capacity that we will be hurt in either way if we have a state appropriation downturn. And the last is the financial issues in the marketplace mean that it is not the best time to go out and secure philanthropy despite the talents in our advancement staff to do that. So our income on the philanthropy side will also be shy until we see some rebound, not just in the markets, but in aggregate wealth and a return to fuller employment. So those 4 are a part of the best case. Would look like our full-time, first-time students would show up in numbers greater than 600. We hope for 650. As of this morning, we have 588 first-time, first-year students planning to come with a paid deposit in the fall. Our transfer students are right at 180. We're hoping for 300. One of the headwinds we will always face is the promise at Western, which allows a student to go to school more inexpensively than us. But we have such market distinction and particularly strong academic rigor and programs. We hope that we will get at or near the 300 that we're hoping for. We will be finishing some of the modeling that we've just begun working on over the last month. By the time we meet again for a town hall, I hope the week of June 15th. At that time, we will also know if there are ameliorating funds coming to us through a second tranche of the CARES Act. So we're looking at both opportunities for revenue, philanthropy from the foundations, and the possibility of a strong enrollment. So the worst case would look like a 10% appropriation cut, fewer than 600 first years coming, fewer than 100 or fewer than 250 or 200 transfer students coming. Those would mean that we would have to table some of our budget operations, and we may, in the worst case, have to furlough some of our employees. At this time, though we are developing the worst case, we do not see that as the likely case. And so, but I wanted to tell you that we are keeping those things in mind. The second question is, well, you ask, how will students be helped? Clearly, students will be supported with financial aid. Our faculty and staff will be supported. The larger number of students that we have, the more likely financially viable that we are. Second question, where's UNCA with respect to enrollment for fall? As I mentioned, we're close to our hoped for goal with first-time first years, strong continuing numbers, still uncertain about transfer students. Question 3, what is the threshold for enrollment that would trigger layoffs for faculty and staff? Is that threshold department specific, or is it based on a total enrollment? It is actually based on the interplay of all 4 of those factors. And we are not likely to know about the state appropriation matters until at the earliest late June, more likely in July or early August. So we'll keep you posted, and this is not department specific. Other than enrollment, what other revenue sources would likely trigger a reduction in employees due to cash flow? There's nothing outside of those 4 things that I told you would be the triggers. And again, remember, there are some savings in revenues. One of you asked later on, what have you saved in utilities? Because the campus has literally been empty and stopped, we've saved about $40,000 a month on our energy costs. That's a very significant amount of money that can be used as we plan for the year ahead as well. Will the price of the fall 2020 semester change because of the shortened time frame? At this time, if we open, and we open with good community standards about wearing masks and so on, we will have the protocols in place to handle any student who needs to be isolated or quarantined or who needs to leave the campus. And we hope to be resilient enough to complete our fall semester in the bracketed dates that Provost Campbell has decided, from August 10th until November 20th. The price will not change. Tuition, we have been asked by the system to make it clear that tuition will be charged for students based on, regardless of which forms of hybrid, online, or as in person. I imagine our utility bills have decreased. I just responded to that. Did the students suspend some services like cable in the residence halls to save money? Long ago, as a cost-saving mode, you moved away from cable television and have been using an IP form of computer-based television in the residence halls and so on. So there's really no net gain there, though it was wise to have done that several years ago. Okay, the health and safety questions. What specific data and especially research-based advice given by health authorities drove the decision to reopen campus? I've just given you some of the reasons why we believe, the state believes, and the UNC system is urging us to return to the demands that we have around us to regain our in-person instruction opportunities. We have been using data about COVID that's coming directly from the epidemiologists at UNC system, the UNC hospitals, by Mayheck and Mission Hospital epidemiologists here in Asheville. So all the way along, both the protocols that we're being asked to consider and implement and the spread of the virus or the flattening of the curve has been led by the expert advice of medical people only. There has been an adherence to science in the decisions that have been made about when we'll start and when we'll end. It is very clear that science indicates that the COVID is likely to return during the cooler months and overlapping perhaps, unfortunately, with this flu season. That's why we've been striving very hard to open earlier and to adjourn a bit earlier. And we hope that is in the best health interest of all of us who serve our students and our staff and faculty. Why was there not more effort to seek student input before making the decision to reopen? There was actually a very extensive survey, as I understand it, that was done through the UNC system of students. I believe it was done through the Association of Student Governments. That group now in the coming year will be led by our very own Isaiah Green as the president of the UNC system, 240,000 students represented by those student governments. There was a survey done at that point. Some other campuses may have done their own surveys. We have been widely engaged with conversations with London Newton, our incoming SGA president, and her colleagues. And so there was student input sought, and that has been considered in what we have decided. But more importantly, we were influenced by the results of the surveys that have come from UNC. What are these, quote, highest quality, best safety protocols that are supposed to mitigate hazards? As my understanding is, the best and only proven safety measures, are to avoid social contact. There's a whole array of protocols that begin, yes, with hygiene and hand washing. 20-second hand washing is so much better than just putting your hands underneath the faucet. We'll find better ways to communicate all of this than I'm communicating today. Social distancing allows, together with face coverings that we will make as a part of our community expectation and standard, are all helpful. So are uniformly trafficked corridors in our university classroom buildings, are the doors in and out of laboratories, mitigating against students passing by each other too closely in hallways. All of these measures, to include the opportunity to test anyone who shows symptoms or to test anyone who's been exposed to COVID and needs to be tested. All of those measures will be implemented, and we will have a full array of those expectations for our community. Some of you have asked, and maybe there's a question coming up here about the requirement. I do not, nor do any of the chancellors at the 17 institutions have the legal authority to require a mask. Literally the only person, as we understand it, in the state who can do that is Dr. Mandy Cohen, who is the department medical director of the Department of Health and Human Services for the state. At this point, all 17 institutions, having worked together, are crafting our own individual statements that say what our community standards and expectations are for our common attention to risk, to health, and to the common good. We have a group led by Sarah Broberg and Kai Campbell and Bill Haggard working together with our students to get a statement written that reflects our own UNC Asheville values. We cannot criminalize someone's inability or unwillingness to wear a mask, but our community concerns can say that someone who is flagrantly not following our community standards will be reprimanded in some way. We just have not worked out what that means or what those actions might actually be. What will be done to ensure the safety of students, staff, and the UNC Asheville community in relation to the virus? I think there are a variety of things I just mentioned, with many, many more to come, including what we do in our dining halls, social distancing in not only our classrooms, but for any events that we have. All those things will be forthcoming as we continue to work directly with MAHEC, with the other 5 chancellors and presidents of the residential colleges and universities in the region, to come up with best-in-class protocols that we will implement. How are you going to manage the fact that students are coming in from major outbreak hotspots and bringing that to campus? Together, some of you have asked, well, why don't you test everybody coming back? And frankly, when we started thinking about these matters now almost 8 weeks ago, a couple of weeks after we'd handled the shutdown and the moving to online, I thought that our testing, not only of every student who returned at the point of return, would be a no-brainer requirement. What I've learned from the doctors, the health professionals, and the UNC system epidemiologists is that the current tests have as many false positives as they have real valid positives. They also have a number of false negatives. And because the virus can be in a person who is asymptomatic for up to 5 to 7 days after they were exposed, that any one point in time when a student or a faculty or staff might be tested is not a good indicator. So instead, what we will do is use symptom checkers upon return, where any student can tell us, have you been in a place where there's been a high prevalence of the virus? Would you like to be in a room where you can quarantine for some period of 14 days or more? If a student becomes ill, we have support to quarantine and isolate, and we have an opportunity for them to go into MAHEC as an inpatient, or for them to go into Mission Hospital as an inpatient. So we will be prepared, but I have been surprised, and maybe you are, the actual testing at the point of return is not as useful or as high value as we wish it could be. Can we assume that all the classroom materials and supplies from pre-spring break are okay to touch and use? Well, remember that COVID was not present on our campus at the advent and start of spring break. And because we extended spring break, we were able to shut down all of our campus buildings and begin at that point a complete sanitation of everything on campus, even though we did not have any confirmed cases before or during spring break. So any materials that are sitting in a lab or a library or in our workplaces, those are all safe as far as we know at this point. If there were anything different, we would let you know. How are you going to manage the fact that students are coming in, similarly to UNC, will all people be required to wear masks? And again, this will come from our community shared expectations and standards. If someone, for whatever reason, does not wear a mask in a classroom, what should happen? If individuals in a classroom are fearful for their life because someone is not wearing a mask, can they leave the classroom, including the faculty member? Will faculty be required to police students not wearing masks? What will be the appropriate response from a faculty member in case a student is kindly asked to wear a mask and they refuse? What is our enforcement rule in relation to students? or others on campus, might some faculty feel pressured not to enforce this order. We will have clearer and broader guidelines relating to the specific instances that are raised here, but the point remains the same. Will we have no way to criminally enforce this or punish non-adherence to our community standards? We expect that faculty should not be, nor should staff, be burdened with any kind of enforcement of the community standards beyond asking a student to comply and put the mask back on or put the face shield on or whatever. Or if they're not socially distancing, to actually move further away. So we'll get clearer on these. They'll be forthcoming. We understand the worry and the fear that's embedded in this question from you. How does one eat and drink or be fully understandable or heard with a mask on? Students and faculty may be required or strongly pressured to wear a mask in class, walking the halls or eating in commons, taking a sip of coffee in class, in the dorms off campus with friends when not being watched. Again, our standards will be clear that face masks, hygiene, respiratory etiquette, social distancing, respect for the other, following the uniform movement through buildings directions, all of those things will be in place to keep each and every one of us as healthy as possible. So more to come on all of that. Also, David Weldon is making it possible for faculty who choose to wear a face mask versus a paper mask over the mouth, so that you can be seen speaking to your class and seen in the expressions and other human characteristics that you have in your teaching style. So more on that later. What precautions will be taken for public bathrooms? This is a good question because the example that we will follow is the example that hospitals and MAHEC and other healthcare facilities have provided. Now, while that can't guarantee that the virus would not be among us, everything that we can do to mitigate the spread, mitigate the advent of having the virus is really key. Similarly to what was announced by the Asheville City Mayor for essential employees, who is required to work on site and come in contact with the public, and who is allowed to stay away from campus and continue teleworking. Heather, I'm going to call on you at this moment to answer this question, if you would.
Sure, yeah. So we've gotten a lot of questions about returning to campus and returning to work. And what I can tell you is that we are in the process of bringing people back to work. We're doing it in a very careful and deliberate way. Everybody who is back on campus, and some people were on campus all along, have protective gear. Our focus has been on the folks whose work is really preparing our campus for our students to come back and for the rest of our employees to be fully back at work. And so that includes cleaning, that includes creating the space in the classroom so that they will be socially distant, installing sneeze guards, those sorts of things. So that's been the focus of our return to work. We do have some people who are deemed as essential personnel during the state shutdown. They did get hazard pay at that time. We did time and a half. When the Governor Cooper's order went to phase 2, we did not continue that pay. And that's a UNC system. We were following UNC system guidance there. And I'll talk more about the total return to work at a later time.
Okay, thank you, Heather. The mandate to reopen for in-person instruction is coming to us from outside of our campus. Feels like it's driven by a number of factors, with health and safety way down the list of priorities. What advice do you have for members of our community who feel they're being steamrolled into actions that are both unnecessary and hazardous? Well, first, we will not open unless we have the appropriate highest and best known protocols to mitigate the virus advent on campus and its spread. That is the single highest priority. Neither are we opening simply for our own financial viability, although that is one consideration. The need to open is that we are needed as an important and significant institution educating the students before us and who join us. The employment viability, because of the privilege it is to work at UNC Asheville, is also in play. and the extent to which we can keep all of our employees employed is also a highest aspiration of those of us who have to look at and craft all of the financial scenarios. If you feel as though you are being steamrolled or forced into these kinds of actions, and if they feel hazardous to you, approach any of us and let's hear more about what your concerns are, because those might illuminate new ways that we should be thinking about mitigating any fear to return to this campus as a collegial community. The next question is, if a community experiences a second wave of cases, is the university preparing to return to remote learning? The answer to that is yes, but it would have to be severe, because we are hoping to be a resilient enough organization that we do not have a repeat of instantaneous move to online, but rather we seek to continue on as long as the environment is safe for our individuals in all of our cohorts, faculty, staff, and students. If a second wave returns, yes, it might return in October. Some have predicted that. Most feel it would be closer to a time in November, December, and January. And you'll notice that we have not set forth any idea of when we will open in January at this point. We'll have to be guided by science there. But the real question for higher education, in partnership with all of us who are a part of this university and all others, is how resilient can higher education become in these times when we must deal without a vaccine, but want to keep our work going. So at any point, we will be driven most importantly by health and safety and medical advice, period and full stop. But the extent to which we can be resilient is one of our highest desires for the good of all of us and mostly for our service to our students. What is the necessary metric or threshold of confirmed cases before the university would return to remote learning? I don't have an answer for that, but that has been recently discussed over the last 2 weeks with the chancellors and with the epidemiologists, including our leader, Dr. Wesley Burke, who is at UNC Chapel Hill, about are there metrics given the scale and the size and the student faculty ratios and so on at our different institutions that would sound the bellwether that we in fact should stop and move to online learning only. So we'll have more to say about that soon. If the measures taken throughout the school year prove not to be effective and a large outbreak happens on campus, what will be done? There again, based on medical advice and the support and help of the UNC system, we will follow the guidance that we receive, including with the leaders of the city and the county. What if we get the virus and have to quarantine on campus? Who will take care of us and ensure we're eating, taking meds, and recovering in a healthy way? Where will we quarantine? Bill Haggard and his team and Volley and Melanie have already determined where we would have a kind of separated quarantine and isolation area. As we say, we have partners with Mayheck and with Mission, also ready to take our students and any other college students in the area who would need to be hospitalized. If you're on campus and you're quarantined, your meals will be delivered for you. We will assist you through the medical center and the health and counseling center with any medications that are new to you or that you do not respond well to. And we will put every support system in place for you to recover on campus, continue your work in your residence hall, in your quarantine space with your academic work first and foremost while you recover. With in-person classes, should we be concerned about the second wave? I think I've dealt with that to the extent that I know what to say at this point. What quantity of risk to the campus population is the university willing to accept, such as the number of confirmed cases before closing, and what is that necessary metric? Again, more to come on that. If a vaccine becomes available during the semester, will students and staff be required to receive it? I can't answer that. I think the persons who will determine that will be the healthcare professionals, both in our city and our city health director, Dr. Jennifer Mullendor, with whom David Weldon and I and others have been working very directly. I think that call, should it become available, would be based on advice about the vaccine from the health professionals. The last bucket in my categories is commencement. Is commencement still scheduled for August 1? yes, with our fingers crossed, and only again if we can do it safely. And we're watching very much what Governor Cooper does with the reopening protocols of the state. We're going to watch to see whether a political convention happens or doesn't. But we are hoping to have our commencement for our May 2020, approximately 550 graduates on the morning of August 1st on the quad, even if socially distanced. Obviously, we'd like them to be closer together if healthy. We'd like them to bring family with them if they're allowed to do so. So this is where state policies emanating from the governor's office will guide what we're able to do. And the last question for my commencement area is how many guests will each be allowed to bring? That'll be determined basically by gubernatorial edict and mandates about the opening of the state. So I'm going to stop there now and move on to Provost Campbell with the questions in the academic affairs area. Thanks everybody for listening.
Thank you all for joining us for this town hall. Some of you are already aware of the plans that we've laid out for our academic return, but many of you may not be. So let me first just take a moment and run through some of the fall details related to academic affairs. The semester, as we've already indicated, will start on August 10th and run through Friday, November 20th. All courses will be expected to come to full conclusion by November 20th, including any final projects or exams. This is a total of 15 weeks, and each course will run as a single full semester course over those 15 weeks. We'll have a day of a break at the midpoint of the semester, Wednesday, September 30th, and we'll be delivering the curriculum in a hybrid mode with the overwhelming majority of classes offered in some combination of in-person, face-to-face classes and online content delivery. There will be a small percentage of classes offered entirely online, but I'm encouraging all faculty and academic staff to think about how we can best provide the kind of learning community with deeply engaged, active learning to which we are committed. Even when coursework, elements of academic support, or some of the high impact practices important to student learning are delivered in part or wholly online, we have every confidence that we'll be able to ensure that the delivery of that content and the interactions that we nurture lives up to the face-to-face experience in the best ways possible. How we do that exactly will vary widely depending on the discipline, the course, the activity, the students involved, and the faculty and staff leading the effort. Many of you have already heard me say that I'm hoping that we'll be able to carry forward some of the best lessons learned from the spring semester and from the summer forward into the fall. Over the next 2 weeks, we will hope to work out all of the details about which specific courses are operating in which mode and how. Whether Bio 101 will meet 1 day in person and 2 days online, or vice versa, for example, all of that will need to be worked out for every single course and we'll get some sense of that over the next couple of weeks. We know that that will shift a little as faculty prepare and develop their courses, but we need to get a sense of where folks are, what kind of balance that will look like. These decisions will determine where classes will need to meet, how many courses will share a particular physical room, and the like. It will also allow us to understand if we have to ask for some more thinning of students in classes to meet the appropriate guidelines for health safety, or if we think we're pretty much ready to go. Some have asked whether there will be options for students to take courses fully online, depending on their own personal situation or preference. We won't be offering a distinct online option for students so that students can say, hey, I want to take what I would normally have taken fully online. But the question will be whether or not an appropriate schedule can be determined based on the courses that we are offering online. Again, we won't really know the answer to that for another couple of weeks at least. And again, it'll be fluid for a little while. but we'll do our very best to get that information out to students as fully as possible, as quickly as possible. Many are rightfully concerned about what happens when a student or faculty member gets sick. First of all, we'll be asking that every person in our community who has any symptoms of sickness of any kind at any point to remove themselves from the community, i.e. don't come to work, don't go to class, stay home. Get checked out and don't return until we know that it's safe to do so. For those students who get sick, we hope that the hybrid form of teaching will make it easier to stay connected to the course. But I'll also be asking faculty and students to work together with a kind of renewed understanding, a different level of understanding of our current situation, to manage any illness situation in much the same ways that we would have in pre-COVID times when a student suffered a serious illness. It'll demand some real understanding and some flexibility, and we hope that the conversations that students have with faculty to work those details out, combined with the hybrid mode, will be sufficient to really make those cases work. In the case of faculty who might get sick during the semester, this can be as challenging, if not more challenging. We'll need to come up with contingency plans that are specific to each case. And while some faculty in some departments have been able to develop contingency plans in the spring, and we may be able to extend some of those same ideas that they developed for the spring, I imagine that this is work that we largely have ahead of us. Many of the questions that we've received have asked about other barriers that we may experience. What is happening in the K-12 schools being a very prominent example. We've been in conversation with the school leadership and heard some very early positive signs, but this looks to be a very rapidly evolving situation at this point. And the best that I feel like I can say at today is that we are aware of this as an issue, and we'll certainly be looking for ways to work through the issue as best as possible. I know that many on the line here are engaged in workshops, learning circles, doing your own research and work on how best to engage students in this unique moment. Having already heard some of the examples of what folks have done through April and May, I'm grateful for the creative energy and thoughtfulness that folks have put into this work, and trust that we will have a number of great solutions ongoing in the fall. Despite the fact that each course will be a single whole course, I'm asking faculty to really think about the two halves of the courses in distinct ways. In particular, I'm hoping that to the best extent possible, we can front load as much of the work that would require physical presence on our campus to be done in the first half of the term. That won't always be possible or viable, but I believe that this may be to our advantage should health conditions change and should we have to consider any shifts in our mode of teaching later in the semester. In our preliminary survey, we asked faculty to let us know what kinds of technologies and tools they might need in order to deliver in this hybrid way. And we're compiling that information, and we'll have to determine how we can best provide those resources to folks who need it. I don't have any details today on particular setups, things that people asked about like cameras in classrooms, specialized software and the like. We'll have more to say about that in the days to come. Hopefully all faculty are aware that we do have some new licenses, things like Camtasia, that I believe we've already begun running workshops for, and there may be faculty here who are already signed up and learning about that technology if they weren't already familiar. I would ask that everyone kind of be on the lookout for announcements about similar technologies over the next month. Some of the questions that came in asked about grading and GPA requirements for Latin honors. We don't anticipate changing the GPA requirements for Latin honors, nor do we anticipate any kind of changes to our grading structure. Some have asked about the WS structure that we had in the spring. We don't anticipate doing that again, even if we do have to move to online courses. We hope that we can continue on and that the plans that we are making now provide for a way for us to complete the semester with our existing grading scheme in place. I do want to acknowledge that I know that the work that we're asking folks to do, the things that folks are preparing for, does in many ways put an extra burden on faculty and staff to do more than ever over this summer. Requires greater preparation than the norm. We're working in an environment that remains constrained and filled with uncertainty. And I just want to say thank you to all of you who are spending the extra time, energy, thought, and care that you are putting in to help us prepare for the fall. Even as I say that, I do also genuinely hope that folks can find some time to take a breath, rest, and recharge as well. As Chancellor Cable mentioned, we are doing a host of things to make sure that our physical spaces are safe from a health standpoint. Installing plexiglass, sneeze guard dividers, spacing chairs in classes between 3 and 6 feet apart, exploring the use of face shields, as Chancellor Cable mentioned. Those are the clear plastic shields that go across the length of the face so that you're not encumbered, faculty, by masks, cloth masks, while you're teaching, if that's what you choose to use. We're exploring a number of other precautions as well to ensure that students can learn and faculty can teach in a space that follows the highest health safety standards and follows the best possible protocols. We have been in conversation with student leaders. This is another question that I think came up in the Q&A just recently. Are we in conversation, and what is the nature of the conversation we are in with students? We had a conversation last night, Vice Chancellor Bill Haggard and I, with about 20 to 25 student leaders. And we plan on having regular meetings with those student leaders and have asked them to be in conversation with the students at large to bring forth questions from them and to be part of the solution for relaying information back out to students. We'll be, of course, updating things as quickly as we can, as much as we know, to the faculty, to the staff, to the students, as we know more. I think there's one other question that I haven't touched on, which is about the CARES Act money allocation and distribution. There's a website that describes our process and gives a report and update on all of the CARES Act money distribution. And we plan on revising that update periodically. We have a new report due maybe in another couple of weeks, which will describe, I think the set of the things that are on the website now describe what we were planning on doing. The next report will lay out exactly what we have done and describe the distribution of all of these resources. So I would say be on the lookout for that report coming in the next couple of weeks. I think those are mostly the questions that folks have asked in the academic affairs area, but certainly welcome to hear. I know that there's some Q&A that I haven't been able to track carefully, and we'll get to that, I guess, if we have time at the end of this.
Thanks, Kai, very much. And Bill Haggard, let's turn to you for the facets of student life that have been affected by our planning now.
Thank you, Chancellor, and good afternoon, everyone. It's good to see you. There were many questions about the out-of-classroom experience and how we will handle those in this current COVID-19 situation. Many of them are about housing and dining, so I'm going to start my comments there and try to speak generally in a way that will answer most of the questions. First of all, our staff has been working very hard to develop plans for this fall. So a few of the highlights of those plans. First of all, I need to mention the advantage that we already have as a campus related to the design of our residence halls. We have smaller buildings as opposed to many other campuses. We have all either suite style or apartment style housing, so there are not the long double-loaded corridors with high populations using community restrooms. It's suite style with normally 2 rooms if it's 2 doubles sharing four people sharing the restroom. So already just by design, the way we normally are, we can already avoid some of the large populations and gatherings in one particular place. But to make that even better, we've been working on additional strategies, and one of those is we're currently at a capacity, and with our current housing stock, we have been able to free up about 54 more spaces for students who desire single rooms. So that will be more singles available to students who choose them. But we've already heard from many students that they would desire to have a double and have a roommate. In addition to that, we will also be able to set aside a minimum of 30 rooms up to, or 30 spaces, excuse me, 30 spaces up to at least possibly 50 or 60 if needed, that can be used as quarantine or isolation spaces. So if someone either had been exposed, knowingly exposed to somebody that knowingly has been tested positive for COVID-19, they have a chance to quarantine. And those who experience symptoms would immediately be able to isolate if it was found that they tested positive as well. In addition to those strategies, we're looking totally differently at how we move people in the fall. There were several questions about how we will move in and when's move-in day. We will move in our students over a series of 11. The idea there is with what we expect to have about 1,550 students in our residence halls based on our current deposits and reservations, that over the course of those 11 days, then we would average about 140 students per day over an 11-hour period with 3 different time periods per day. Starting in the last 2 weekends of July, not to come and stay, but we're giving those students who would desire to do this to come on either a Friday, Saturday, or Sunday in the last 2 weekends in July, move in their belongings, get settled, and then go back home and come in, check in right before the semester starts. Once we get to the week before classes start, starting on the Sunday, August 2nd, we will have certain early arrivals, our pre-rendezvous program, some of our student athletes who also come in with staggered move-ins, and other student leaders who traditionally come back early will start on August 2nd. Tuesday, August 4th, 5th, and 6th, that Tuesday through Thursday, our first-year students will come and move in, those who haven't already moved in their belongings to begin with. And again, over the course of an 11-hour period, spread apart. That way, we avoid the congestion, we avoid the traffic, we avoid the lines, we avoid the long lines waiting for the elevator and all those types of things that are part of a normal, exciting move-in. All of those, the crowds will be reduced. As a matter of fact, we intend not to have crowds if we get the cooperation of all those involved to spread themselves out over those days. Then our continuing students will continue to move in that Saturday and Sunday, the 8th and the 9th of August. So if all goes well, and we anticipate it will, with the cooperation of members of our campus community, that's how we plan to move people in, reduce the population that's present all at one time. Some of the other strategies in the residence halls, people are saying, how is this going to work? And how will we arrive at the social distancing? It's going to be incumbent upon the residents themselves to do all the prevention measures that we have all heard about already related to social distancing and the right PPE, the mask wearing, the respiratory etiquette, and the hand washing and hand sanitizing. There'll be increased numbers of hand sanitizing stations throughout campus, throughout the student life buildings. There'll be increased prevention and education programming before, during, and after students arrive. Really looking to build a culture of compliance where we each not only just take care of ourselves, but we take care of ourselves in the context of caring for others as well. So some examples of those things is we will limit the number of students who will gather in certain spaces. We will remove some furniture from some of the lounges to help reduce the size of some of those areas, the size of the crowds in some of those areas of gatherings, not necessarily crowds. We've even talked about making one-way stairwells and limiting the elevator use to only those who who have the real need to use the elevator. So there's a variety of strategies that we're still working through, a lot of ideas. We're consulting with a lot of best practice, including the American College Health Association, ACHA, who has guidance for higher education institutions. Those are folks who specialize in college student health, as well as the CDC, and as the Chancellor mentioned earlier, our partners at NAHEC and other local authorities. And also our staff are constantly working on listservs and in virtual meetings with their counterparts on other campuses, looking for best practice and the best ideas. Related to our dining experience, it's the same similar strategies. We'll be trying to reduce the dine-in population. We will have more options for takeout, but still choosing to dine in will still be possible with reducing our number of tables and chairs. We'll have some plexiglass dividers in particular areas. We've already had staff go through working on those strategies, including floor decals with directions and separate pathways for those choosing to dine in and choosing to take out. So several strategies will be used in Brown Hall, including what we're normally used to, helping ourselves to the food. All of the food will need to be served from behind sneeze guards, so there'll be some change for those of you who are already familiar in eating in those areas. There'll be some changes, but it is our goal to still maintain the quality, the variety, and also the attention we normally pay to those who are vegan or vegetarians, or those who have food allergies or other special needs. We do not intend at all to compromise the program itself, but just the way it works. We'll be increasing some opportunities for outdoor dining, again, to help spread out folks, but also if you choose to take out and then go to your own private space to eat, that works as well, and that will help us in that regard. We had some specific questions about RA training and other student leaders who typically come earlier. Our RA training that is normally 2 weeks in person will be the first week virtual and the second week in person, again, to gradually move into the in-person experience. We'll be doing that with some other early arrivals, other student leaders, other student staff who help us with the opening of our student life facilities. We're working in Highsmith Union and other student life spaces. Actually, Highsmith has remained open continuously since we first left the campus in mid-March. We have had some local students who have needed a good broadband connection, and during the end of spring semester and during some of our summer semester, we've had small numbers of students who still come to Highsmith. So we have had to do their work and to use the broadband. So we've had the opportunity to practice our social distancing and increase our signage, and again, make adjustments with furniture and other ways to help ensure the social distancing. There's a question about will the shuttle continue to run? Yes, our shuttle service is critical to getting people where they need to go on campus. We will be that will be an experience where it's just critically important to wear a mask, and again, looking for that culture of compliance for folks to do that. And we're looking at other strategies, potentially with the use of plastic or plexiglass or other ways to ensure separations, but our shuttles must still run. Questions about a health and counseling center. Our health and counseling center has remained open continuously with limited hours since this all began. Our numbers in the counseling area did not decrease significantly for the remainder of the spring semester. There was a lot more remote, either phone or other remote means for the counseling services. Those will continue, and all the normal services will still be available. Our health services staff has continued to be involved in telehealth and other delivery of their services, and have been staying right at the leading edge of all of the trends and all the trainings and all the advice, the best advice that comes not only from the CDC, but from the State Health Department, our County Department of Health and Human Services. There's been consistent communication there so that we are ready to handle just about anything that comes to us. And if there are things that go beyond what we can handle, we have the community partnerships that will help us deal with those worst case scenarios that we optimistically hope to prevent. So that's an overall summary of what we're doing in the campus life areas. I've tried to address the general areas of the questions that have been presented.
Thanks, Bill. Appreciate it. And Heather, let's move to you now on human resources questions and concerns.
Thank you, Chancellor, and thank you everybody for joining us today. Chancellor Cable talked about one of the frequently asked questions we've been getting already, which is, are we going to furlough or lay off or terminate employees? And as she said, we don't have any current plans to do that. But the financial future is unknown and depends on state budget appropriations, enrollment, and other funding we might get from the federal government or the state government. And so we're not making promises, but what I can promise you is that we are working very hard to make sure that we keep our faculty and staff employed. There was also a question about student employment and wondering if there would be less student employment. We are carefully evaluating that. Student employment and giving our students employment and professional opportunities is an important part of our campus culture. But we are looking closely at all requests for student employees. So I'll say that. The other question, and I brought up the return to work earlier. What I wanted to also highlight is that we know that we have some faculty and staff who will feel uncomfortable or are concerned because they may be in a high risk category. They may be caring for somebody in a high risk category. They may have other needs. And so we will have essentially 3 categories where people can share their concerns with us. The first are accommodations. So if you have a disability, a documented disability, and you need an accommodation, that process remains the same. HR will take that request at any time and evaluate it as we would in non-pandemic times, as well as during the COVID pandemic. The other is family medical leave, and that the typical family medical leave now has an overlay with the Families First Coronavirus Response Act, or FFCRA. I call it FCRA, and that's an additional pot of leave for people who may have elder care needs or have other COVID-related needs. It's pretty complicated. Every case that comes to HR is really, we have to analyze on a case-by-case basis, but we are doing that and we're equipped to do that. Then the third category are what we're calling considerations, and this is in line with what the UNC system is asking every institution to do, which is if you may not have a disability, you may not have a reason under FMLA or FFCRA to take a leave or have a flexible work arrangement. And we are creating a form that you will be able to fill out to say, I would like a flexible work arrangement. I would like something different because I have concerns about COVID and my own identity, whatever that might be, whether you have someone in the home, whether it's you. And so we're going to be setting up a process. What both President Roper has said, and he said this in the last Board of Governors meeting, is that it needs to be a fair and equitable process, both within our small institution and then across the entire UNC system. And I think that's it. I did see one question whether staff would be getting face masks as well. And I believe Chancellor Cable covered this, but I'll just say we are preparing to have face masks and other protective gear for our entire community. So it's faculty, students, and staff. Thank
Heather,
you.
thank you. And on the heels of that report out, we will also have adequate hand sanitizer. We will have a number of the things that we know can contribute to the health and safety of our community to mitigate the virus. Sarah, before I make a few brief comments at the end, do we have some questions that we can handle if we have time to do that between now and 1:30?
Yes, thank you for the generosity of your time, Chancellor, in extending this, and thank you to everyone who's remaining with us while we work through these questions. For the student life area, there are many questions related to housing specifically. Bill, talking about the move-in, if you could maybe just reiterate that, the time frame in which that's taking place. And if you could also mention a little bit about what might happen if someone were to get sick and not able to return home. Could they talk about the isolation and the quarantine process there too, please?
Okay, well, as I mentioned earlier, and I don't want to take the time to go through all of it again, but we will be spreading out the move-in process over 11 days. There has already been communication that has gone out to all of our resident students. So look in your inbox for an email from Residence Life at unca.edu, and you will find that information. But starting with a couple weekends in late July to move your belongings in early and then go back home is one way to help spread out that process. But then the actual move-in will be then staggered for that week prior to the beginning of classes. So for a student who becomes ill, who is a resident student, we want all members of our university community, as soon as they feel symptoms that may be consistent with those symptoms that have been described that are consistent with COVID-19, they should stay in their home, wherever that home is. Even in the residence hall, that would be your room. And then to immediately call our health services, and our health services will begin with the telephone triage, and then we'll go with protocols if necessary, if the telephone triage leads them to believe that you need further checkup. We will have, as I mentioned earlier, we will have quarantine and isolation spaces in the residence halls, so you may be asked then to move to another space, a space where you can stay either until you get well or until we know for sure that you don't have COVID-19. We will not be testing everyone, as the Chancellor mentioned earlier, but we will have the ability to do testing through our health services as long as those tests are available. And if not, we will have community partners that will support us in the testing. We will test those students who our medical providers, our physicians and other providers believe testing is appropriate because of the symptoms, and we will get those results back as quickly as possible. Then, as the Chancellor mentioned earlier, we will make sure that you have all you need while you're quarantined or isolated in your space on campus, as far as food and other things that you need. Any other further questions, please direct them either directly to my office, or if they're housing related, directly to the housing office.
Thank you. Provost Campbell, there were a few questions related to online options for courses and the workload required for that from faculty perspective. So if maybe you could just talk to that generally, reiterate your earlier comments.
Yeah, so I was actually just going to respond to Anne's question there. So we simply don't have the capacity or the resources to ask every faculty member to teach in 2 different modes simultaneously for every one of their courses. That's just simply not going to be possible. And so we are going to we're going to ask faculty to deliver the course in a hybrid way, in what they feel is the best way possible for the course, and get us to a point where we can. I think what we'll have across the spectrum is a few courses that are entirely online, all the way through potentially a few courses that are completely in person with no online component. At both ends, we probably will see just a smaller percentage. The bulk of courses will have material that does both. We will work as best we can. If a student really feels like they want to have a completely online experience, the only option that we can offer at this point will be to make some choices among those courses that are delivering the content fully online. The thing I guess I would want to say is that we're really pushing everyone, even those for whom the bulk of the material is delivered online, to think about what it means to deliver the course and make best use of our physical campus, the resources that we have here. So even in those courses where the lecture material, the content delivery, if you will, is online, what we're looking for is a hybrid thinking, even in those modes, even in those courses. So, you know, we want folks, even, you know, if it's somehow an art course or a drama course or a lab course, where much of the prep material is presented online, being able to come in to the space, use the lab, use the facilities is going to be important. And so, you know, that's the way we're imagining doing this. We'll get more details about how individual courses, how individual faculty are imagining these over the next couple of weeks.
A couple of follow-up questions for you, Provost, asking about when you anticipate the schedule will be available for classes, whether or not there'll be a fall break, and then any idea about what possible fall commencement might look like.
So there will be one day of break, Wednesday, September 30th. There will not be the normal fall break. We do hope that we'll have an active campus at that time, so that just to be frank and honest, we don't want to have students leaving and going off in various different locations and then coming back to campus. We're really trying to limit that. And so we will have that day, and that'll be the extent of our fall break. As for fall commencement, we have not made a final determination about that. We had thought possibly about the idea of trying to get that in before Thanksgiving. Not clear whether or not we'll have the time necessary to wrap up the fall semester and then still do that before Thanksgiving. But we're certainly looking at that, or whether it would have to happen sometime after Thanksgiving. So we'll get more details on that as we move along. And there was one other question that I think I've lost there. What was the third question?
I think it was about the fall break, when you anticipate the course schedule will be available.
Course scheduling. Yeah, so as I've said, you know, we are looking at, so first of all, let me say, the courses that are on the books, we imagine going forward. We aren't changing and offered at their existing times. We aren't changing the course schedule. What I think that question probably is asking about is, when will we know the details about any particular course? When will we know whether my course will be meeting one time or two times in person and one or two times online, or what kind of configuration in this hybrid model? Again, we're collecting information. We will be collecting information over the next couple of weeks from faculty, but knowing that faculty will evolve and shift as they prepare for this new mode over the course of the summer, there may be shifts. There may be some changes to that. So we hope to give a preliminary look in about 3 weeks, 2 to 3 weeks. But again, that won't be definitive. It'll evolve somewhat, but we hope that will give a pretty solid sense.
Thank you. There are several questions here for Student Life. So Sam, Rhonda, Emily, Sophie, please direct your questions to Dr. Haggard and his office. I think they're very specific. I think that he'll be able to help answer those related to move-in and a few others. And there is a question here about an undergraduate research symposium and whether or not that will be taking place in the fall, Provost.
We haven't yet made a determination. Usually that's a day that's set aside as a whole day. And, you know, with a constrained schedule, the question is, you know, what day might that happen? And we just really haven't thought about that, whether or not, the one possibility would be to use that that Wednesday, September 30th, but I am trying to preserve that as a day of break, a true break. And so we have not yet determined that. And so I would say stay tuned.
Thank you. A recording of this will be made available before I turn it over to the Chancellor for her closing remarks. So just to answer the last question that came in, we will be closed captioning this video as required by ADA compliance, and we will be posting it to the coronavirus.unca.edu website under video updates. So Chancellor, would you like to wrap it up here for us?
Thank you, Sarah, and thanks again to you and your team for making this possible. What are the next steps? Well, the reason why your questions and your voice and your concerns are so important is that the system is asking all 17 institutions to prepare a detailed report of everything in all vectors of our work: student life, academic affairs, admissions, athletics, health protocols, medical and counseling center protocols. And we are in the process of preparing that, have been actually for the last 3 to 4 weeks. We are due to present our proposal to the system leadership on the 9th of June. And after that time, we'll likely receive any feedback or approval, we hope. And then we would like to have another virtual town hall the week immediately following that date, so that we can tell you where things stand, answer some more of the specific questions you asked about health protocols, and then also convey any other decisions yet to be made in late June and July. That's what the next step is. Answering your questions is helping us do our work better. So if there are questions you think of even following this time together virtually, please reach out to any and all of us, because they will guide us to be better prepared than we would have otherwise been. Please do hold August 1st. I'm very hopeful that we'll be able to honor what the students said so clearly. They did not want a virtual graduation. They wanted a chance to be back together and in the presence of their faculty and staff to receive their degrees. So please circle that, and hopefully we will be able to do that. You know, finally, I personally feel that one of the biggest challenges here is the uncertainty in the situation. There's so many voices to listen to. There are so many demands that we do certain things certain ways that we need to understand and suss out. There's frankly research we need to delve into and know that we are following the best possible science-driven protocols. We're getting good help to do that, but this is an uncertain and evolving situation. So please be watching for notices that may come out, any surveys to gather your opinion. All of that is important to us. Despite the challenge of uncertainty, I am really very confident that we will come out of this as an institution that is resilient in higher education, that we will come out stronger as a collegial, mutually supportive, and uniformly welcoming place to each other and to those who will join us to get through this period of difficulty, of threat, and of worry and fear. I also believe that we will have the opportunity to be innovative. We've already seen that with the work of our faculty and many of our staff. Crisis does allow us to crack open what we're doing and to see if there's some new light that we can bring into the situation. And I'm hopeful that we will do that. This will also be a time eventually to evaluate what we did well and what we could have done better. We couldn't have planned in some ways for the scale and breadth and depth of impact of this COVID-19 virus. But we will be studying this, and it's important that we be present together in the moment about what can be done better and how we can care for each other while keeping ourselves safe. I am grateful for the personal privilege of working at this university and for all of you. It is a privilege to be affiliated with this great institution, one that I believe in deeply in my heart. And so in every way possible, I'm encouraging us all to lead the institution well, safely, with our academic vigor and our energy around the young people who come to us and our non-traditional age students, and even in the face of this difficulty, to do our level best to persist, to be careful, and to be resilient in the face of this difficult situation. I'm grateful to each one of you. Please don't stop now. We have some really good and important work together. So let's get at it. Let's keep each other informed. And I'm grateful for the time you've spent on this long call today and for the questions that you provided. I also want to thank all of my colleagues on the call today. I appreciate your time and effort as well. Thanks everyone, and we'll be in touch, and please you stay in touch as well. Thank you.